Assalamualaikum and hi. Today we will be talking about the adrenal gland in the endocrine system. Our team consists of me, myself, Ahmad Afizuddin bin Sam Jamal, Nur Alfa Shafira binti Muhammad Salto, Sharifah Nuzaida Izati binti Syed Omar, and Kak Jiang Yi. In this slide, we will be talking about the disease related to the adrenal gland, namely the Cushing syndrome and the Addison's disease, centered around the production of cortisol. We also interviewed Madam Nora, a pharmacist, to help us to have a better understanding on the topic. This is the table of contents for the contents in our slide.
I will start presenting about the adrenal gland. What is adrenal gland? Adrenal glands, which also known as the suprarenal glands, are small triangular-shaped glands located on top of both kidneys. The adrenal glands are composed of two parts, cortex and medulla. These parts also secrete different hormones which act as chemical messenger. For cortex, which is the outer portion of the gland, secretes three types of hormone: cortisol, aldosterone, and DHEA. As for the inner portion of the gland, which is the medulla, it secretes adrenaline and noradrenaline. Adrenal glands may develop nodules that can be benign or malignant, which can potentially produce excessive amounts of certain hormones, leading to various health issues. For the functions of adrenal glands, as I said before, there are five types of hormone produced by the adrenal glands. So, the first one is aldosterone. It helps in balancing the body salt and water level. The second one is cortisol. This hormone aids in regulating body metabolism and involved in response to illness. As for epinephrine, or known as adrenaline, it increases the body performance and strength. Next is norepinephrine or noradrenaline. This hormone increases the blood flow to brain and muscles. Last but not least, DHEA, which helps to produce male and female sex hormone such as estrogen. So that's all from me, and I will pass to my next group member. Thank you.
Next, I'll be explaining about the adrenal gland hormone production. The process of hormone production in adrenal gland starts with the hypothalamus producing the corticotropin-releasing hormone, or CRH for short, that will stimulate the pituitary gland to secrete a adrenocorticotropin hormone, or ACTH for short. The ACTH will then stimulate the adrenal gland to make and release hormones into the blood. This includes the cortisol and aldosterone hormones. Next, the type of drugs that can affect the adrenal gland is the drugs that affect hormone production, because these drugs, if taken overdose for a long period of time, will have serious side effects. Steroid, specifically the corticosteroid, can cause the elevation of cortisol production, which causes the Cushing syndrome or hypercortisolism.
Hi, my name is Nur Alfa Shafira binti Muhammad Salto, and I'm going to continue with the presentation about steroid. So firstly, what is steroid? Steroid is a man-made version of chemicals, and it is hormone that is made naturally in human body. It acts to reduce inflammation and other symptoms such as swelling, pain, and stiffness. It is also known as corticosteroids, and it is used to cure many types of arthritis. Next is Cushing syndrome. So the main cause of Cushing syndrome is adrenal gland produces too much cortisol. Pituitary adenomas, which is a benign tumor of pituitary gland that secretes increased amount of ACTH that causes a lot of cortisol produced in adrenal gland. The function of cortisol is to help body respond to stress and change. The factor that trigger a lot of cortisol produced is overuse of cortisol medication that usually used in treatment of chronic asthma and rheumatoid arthritis. It is estimated about 10 to 15 million number of people affected every year. For the symptoms of Cushing syndromes, the patient will show the symptoms of round face. Next, they will have thin arms and legs. They will weight gain unexpectedly, and lastly, they will have low fertility. For the effects of Cushing syndrome, if the patient does not want to take any treatment to cure their syndrome, they will have osteoporosis, which is a bone fracture, unusual bone fracture. Next, they will have hypertension, which is a high blood pressure, type 2 diabetes, loss of muscle mass and strength, and lastly, they will experience frequent or unusual infection in their body parts. That is all from me.
Hello everyone, my name is Kok Sang Yi and I'll be continuing on treatment for Cushing syndrome. So as we know, there are two types of Cushing syndromes, which is exogenous Cushing syndrome and endogenous Cushing syndrome. So the treatment for these types of Cushing syndrome is different. To treat exogenous Cushing syndrome is basically by medication. The first way is to consume medicine that lowers cortisol level. As Cushing syndrome, there are too much of cortisol in our body. The second way of treating the exogenous Cushing syndrome is by decreasing the dosage of corticosteroids. This scenario is in which you are already consuming corticosteroids to treat other diseases such as asthma. So to treat endogenous Cushing syndrome, on the other hand, is by the removal of tumor. So now we'll continue on Addison's disease. So what is Addison's disease? Addison's disease is also known as adrenal insufficiency or hypercortisolism. This is a relatively uncommon disease and is characterized by inadequate production of cortisol and aldosterone by the outer two layers of the adrenal gland, which is called the cortex. So what does cortisol do to our body? It helps our body to respond to certain stress such as illness and injury. It also helps our body to control our blood pressure. On the other hand, aldosterone, it controls our blood pressure and it also helps to control the flow of fluid out of our body as urine. So Addison disease is a disease that affects all age group and sexes. Basically, it's more common in women which are 30 to 50 years old. Now we'll continue on the symptoms, causes, and treatments for Addison disease. So there are many symptoms for Addison disease, but a few common ones are listed here. There are abdominal pain, weakness, weight loss, and craving for salty food. So the cause for Addison disease includes damage on immune system. This scenario happens when there is error in your immune system and it attacks the adrenal gland. So the damage of your adrenal gland will cause Addison's disease. The next cause of the Addison disease is by having chronic diseases such as tuberculosis. The treatment for the Addison disease is basically by taking in hormone to replenish the lost hormone in your body. To increase the efficiency of the treatment, the patient can have a diet high in salt, as Addison disease will cause a drop in your sodium level. So in conclusion, adrenal gland is an endocrine gland that basically controls the level of hormone in your body for certain function. Drugs and steroids can affect the adrenal gland, and it may cause certain diseases such as Cushing syndrome and Addison disease. So care must be taken by us to maintain a healthier adrenal gland to lead to a better and a healthier life. Before we end our presentation, we would like to thank Madam Nora again for sparing her time for the interview session. It has truly meant a lot for us. So thank you for listening.
Actually is meant to release certain hormone uh, to it helps the body to respond to certain stress. Actually, they have four types of hormones. We call the first one called cortisol. The other hormone we call it aldosterone. And then the third hormone is we call it aldosterone. The other one we call it adrenaline. Adrenaline is more lesser effect. This one the question a bit confused. Actually confused, meaning that if you say is what effect of drugs, lesser effect, that means some drugs that don't give much effects to the adrenaline gland, but usually actually not much of the drug that cause this type of thing. The main thing the main drug that cause this problem to make the adrenaline gland hairwired is steroid testing. Like usually people who got asthma, got allergic reaction where they have to take steroid like prednisolone, dexamethasone, betamethasone, or hydrocortisone. This type of steroid that can boost up the level of cortisol, and then they will suffer, they will experience some side effects. Actually steroid, like sometimes you see when some people they take certain for example the bodybuilder, they take certain supplement, they jab certain drugs to what we call it, to boost their muscles, but this is a transient effects, and they have a after effect of the medication, the thing that cause the cortisol elevated, and then they do have a side effects. Okay. Cushing syndrome is due to adrenal gland produce too much cortisol. This thing happen for the people who take high dose or high dose and prolong consuming steroid like prednisolone, betamethasone, dexamethasone. The sign of symptom of Cushing syndrome, you can see they have a fat build-up in back of the neck, a fatty hump between the shoulder. We call it buffalo hump, and they have a round face, moon face, unexpected weight gain. They have a big abdomen, but they have a thin arm and legs. Okay, some also suffered of overgrowth of hair. We call it hirsutism in the thigh, in the whole body actually. They have some. They have slow growth in children if affect small kids. Okay, and they have a low fertility in female and libido in male.
rendah.
Okay.
Libido
Actually,
lagi rendah.
we call it the problem when they have they have Cushing syndrome, the one that I explained before. That means because of if exogenous is due to medication, like they take what we call it steroid and then sometimes because of they have a growth of tumor also. They have hypersecretions of this type of problem, this type of thing. Or because of surgery, if let's say they have a Cushing syndrome, they have a high level of cortisol, then they have to remove certain part of the glands, or then this the less become the hormone become lesser, so they have a disease that we call it Addison disease. The other thing is mostly because of injury also can cause this type of thing, and then and some tumor sometimes is at the adrenal gland itself, but sometimes it's at the brain, because they have a connection of the brain. We call it pituitary gland, and they have hypothalamus. If they have some problem over there, meaning that some brain injury also, it can cause the adrenal gland become haywire.